I've got a very specific routine every day. I come to work about 6:30 in the morning. I prepare my room, the operating room, the anesthesia equipment and drugs for the operation that I've been assigned to. I go to the holding area, which is the pre-op area where the patients are prepared prior to surgery, and I introduce myself to the patient and interview them, ask them medical questions about their history and physical findings, and do a exam which is relative to my anesthetic that I'm going to deliver to the patient. And then we will start IVs so that that's our major mode of delivering our anesthetic is through intravenous lines, and then we go. At about 7:15, I move the patient into the room. We apply the monitors, which include EKG, pulse oximetry, which is the oxygen level in the blood. We apply blood pressure cuff. Then we begin to administer the anesthetic, and we do that through the IV line. It's a combination of sedative drugs and high-dose narcotics. It puts the patient to sleep. You know, being able to get the faith of the patient, the reward of getting them to sleep, making sure they don't feel any pain, don't remember anything, and then in recovery room, making them comfortable in there after the procedure with various pain medications, make sure they don't get sick. Nausea is a big downfall of the anesthetic process, is that a lot of patients will have nausea, and if we can prevent that, we feel that's a big accomplishment. Experience is extremely important, and the years make some things do come easier in what we do, but there's always a humbling specific patient that gives you trouble that you don't anticipate, and the job is extremely humbling. But at the same time, it's rewarding and very enjoyable on a day-to-day basis. From a high school standpoint, I graduated from George Washington High School, and they offer anatomy, physics. I believe there's a physiology class that's real important. Certainly all the chemistries. I think math is probably an important, calculus and whatnot. Being able to work with numbers are quite important as well, because we do calculate a lot of different medications, a lot of drugs that we have to administer. But I think probably as important as classes is extracurricular activities. I think if there's anything that I may have done differently back in my day would be spread my wings a little bit and maybe got involved in a few other things. Even certainly working in a hospital or in a healthcare facility as you graduate from high school and into college is very important. It lets you decide whether or not you can take it or not, being in, seeing blood and people coming in sick and whatnot. If you can handle it, if you're compassionate to take care of them, and whether or not that's your thing, and getting it early will kind of help steer you into doing that. And I was able to work at Thomas Hospital out of high school, which was nice. I was on the floor. I didn't see a lot of patients, but it was still a healthcare environment. There are a lot of other opportunities. I think there used to be a medical explorers in town associated with the Boy Scouts of America that kind of would have guest lectures come in and teach you about different specialties. And there's a lot of different arenas to do that. But any opportunity that you get, you should take it to give you a chance to get a feel for what it's really like. People can talk to you forever about what they do, but until you get into their shoes and see what goes on, help you make those decisions.